Hello and welcome. I'm Granville Angel, your entrepreneur, natural health consultant, and your guide to holistic living. On this channel, we'll dive into understanding the human body, natural healing, and how you can take charge of your health and longevity. If you care about living well and staying well, you are in the right place. Let's get started. In cerebral blood vessel elasticity, we are majorly concerned with the arteries that supply blood and nutrients to the brain. The brain artery or the neck artery controlling the brain has injuries, which leads to disorders of intracranial blood circulation and damage of brain tissues. In cases where the elasticity of the hardened brain blood vessel is weakened and the vessel cavity is narrowed, this easily forms what we call cerebral thrombosis, which are primary blockages in the arteries which leads to tearing of these vessels. If the patient with cerebral arteriosclerosis drinks excessively, the blood pressure will be suddenly elevated. The blood vessels will get to a stage where they can no longer accommodate this pressure and therefore will be ruptured. So it is prone to form cerebral hemorrhage. This condition usually leads to hemorrhage. After loads of drinking of alcohol, the concentration of alcohol in blood can reach its peak at half an hour. The alcohol can not only directly stimulate blood vessels wall, will make it lose its elasticity, but also stimulate the liver to promote the synthesis of cholesterol and triglyceride, thus leading to arteriosclerosis and cerebral arteriosclerosis. Cerebral disease or cerebrovascular disease, which are diseases associated with the brain and its vessels, can be divided into acute cerebrovascular disease and chronic cerebrovascular disease according to their process. The acute cerebrovascular disease includes the transient ischemic attack, cerebral thrombosis, cerebral embolism, cerebral hemorrhage, subarachnoid hemorrhage, and so on. The chronic cerebral disease includes cerebral arteriosclerosis, cerebrovascular dementia, cerebral artery steal syndrome, Parkinson's disease, and so on. The cerebrovascular disease, which is known generally, refers to the acute cerebrovascular disease, which often endangers the human life due to the acute incidents. So it is easy to attract the attention. The chronic cerebrovascular disease, however, is usually ignored by people due to its long course. In clinical diagnosis, if the cerebral blood vessel elasticity factor reading is high, this usually indicates that the vessels have become weak, and symptoms can be seen in lightheadedness, dizziness, weakness, and in most cases fainting. If the cerebral blood vessel elasticity factor reading is, however, low, this is a primary indication that the vessels have become less elastic or become hardened, which is of a high risk of stroke and heart attack. Patients with these conditions usually tend to ignore some of the symptoms that are triggered at the early age. But however, paying close attention to your lifestyle, what you eat, your sleeping pattern, the amount of sudden changes in your sight, vision, weakness, and state of mind can help you diagnose yourself. But it is usually advised that you go for regular checkups when you start experiencing some of these symptoms like the fainting, the dizziness, the excessive weakness, and irregular sleep patterns. Early detection can go a long way in diagnosis and treatment of these conditions, as it will save a lot of cost in treatment and save your life at the long run. Sincerely, thank you for watching. If you found this helpful, don't forget to like, share, and subscribe for more health insights and natural wellness tips. Remember, healing the world starts with one person at a time. Stay connected, stay informed, and I'll see you in the next video.